Welcome to Week 1 of Human Diversity in Healthcare. In Module 1, you'll be getting an introduction to many of the concepts that are going to be discussed throughout the course. We're going to be focusing on the description of anthropology and how that relates to human diversity, and then differentiating different terms such as culture, race, and ethnicity. We're going to define cultural competence and its relationship to healthcare, and then you will be submitting your own cultural story called the self-analysis reflection. To start, we need to define what anthropology is. And we know that that's actually a study. It's the study of people. It's a study of people throughout the world and across different time periods. And it takes a look at the differences among people. It talks about why there are variations and differences among specific groups or many groups. They teach about human diversity. So anthropologists actually teach about the differences among people, and that's what human diversity is. It's the differences among people, but it's also how those differences impact society. Some of those differences may include biological, social, or cultural differences. In America, gender, culture, ethnicity, and race often have the most far-ranging impacts on us as individuals. It's the way we categorize people. I'd also like you to take an opportunity to take a brief quiz and then to explore different concepts and understandings around diversity. The link in the course room will take you to this webpage, which is supported by PBS. And it discusses how geneticists, anthropologists, and biologists are truly unlocking human variation and the evolution of our species. Take the quiz and see what you know, and then explore the concept of diversity a little further. We're going to take a closer look at gender, culture, ethnicity, and race as we continue throughout the course, beginning with culture. So we do know that culture plays an important role in not only determining how we see things, but also our behaviors and how we relate to other individuals. Madeline Leininger was a nursing theorist, a nursing professor, and a developer of the concept of transcultural nursing. So according to Leininger, culture is a set of beliefs, values, and assumptions about life that is widely held among a group of people and that is transmitted across generations. Can you think of different cultures that we have in America? We certainly have many different beliefs, values, and assumptions within different groups. We know that through culture, people and groups actually define themselves, and with culture, we have social aspects such as language differences, difference in customs, certainly values, norms, mores, but also rules, technologies, and many different institutions have different cultural practices as well. So if you work in Lancaster General Hospital, your hospital may have different cultural practices because of the area we live in than York Hospital or Wellspan or Harrisburg Hospital, Pinnacle, Good Sam, the VA. Now it's time to differentiate between the concepts of culture, race, and ethnicity. So race is defined as a group of populations that share biological characteristics. When you think of these different terms, the key term for race is that biological characteristics are the determinant that many have used over the years to classify different races. Different examples, of course, are things like hair color, skin, as well as certain facial features. Skin color remains a primary trait which Westerners use to place people into racial groups or categories. But then if you look below, according to Brislin, race is primarily a social classification. Now, many times we continue to use such physical markers as skin color, but it certainly is a social classification, and there are different beliefs with regards to human diversity and the concept of race, and they can be seen at the website that we were on previously. Consider the question at the top, is race for real? And then look at what they say here. There's less and more to race than meets the eye. So consider clicking on the different numbers and seeing what you can learn about the idea of race defining the differences among people. So let's recap a bit. Culture is a set of beliefs, values, and assumptions about life that is widely held among groups of people. Race is a classification based on biological characteristics such as hair, skin, and facial features. Ethnicity is different than race, but holds some cultural values and practices. So an ethnic group or ethnicity is a group of people whose members identify with each other through a common heritage, often consisting of a common language, so that's consistent with culture as well, a common culture, often including shared religion, and an ideology that stresses common ancestry. So the key difference here is that common ancestry. And of course, distinctions between nationality, religion, linguistics, and then cultural heritage. So an example of an ethnic group would be Irish Catholic. You can see the distinction of the heritage as well as religion. So now that we've taken some time to differentiate between culture, race, and ethnicity, let's take a look at the American culture. We know that American history began with waves of immigrants coming across the ocean, bringing their own cultures, traditions, practices to our country. And we also know that there's no other place in the world that has such a diverse population. It's this diversity that makes us who we are, but yet at the same time, this is also what has created some challenges. So today, the trend is moving towards multiculturalism, not assimilation. With the old melting pot metaphor, individuals were losing a piece of themselves, losing their own cultural identity. That metaphor is giving way to a new metaphor called either the salad bowl, or it's sometimes referred to as the mosaic or the stew pot, where mixtures of various ingredients keep their individual characteristics. So in a salad, the tomato still tastes like a tomato, but in the melting pot, everything was blended together. Immigrant populations within the United States are not being blended together into one pot anymore, but rather they're actually transforming American society into that multicultural mosaic. America has traditionally been referred to as a melting pot, welcoming people from many different countries, races, and religions. The melting pot, as we noted on the previous slide, is a metaphor for the way in which societies assimilate, in which the ingredients in the pot, people of different cultures, races, and religions, are combined to develop a multi-ethnic society. Assimilation actually leads to a loss of their own traditional culture in the process. So we know that the trend is moving actually towards multiculturalism, and the salad bowl concept suggests that the integration of many different cultures of the United States allows individuals to maintain their traditions and cultural practices, as opposed to the prior metaphor of the melting pot. The concept of multiculturalism is certainly And that leads us to the need for cultural competence. So we already tailor healthcare in different ways. If you think about our specialty practices such as pediatrics, gerontology, women's health, those are ways that we tailor practices to different groups. Cultural competence in nursing is a combination of culturally congruent behaviors, practices, attitudes, and also the key word here is policies that allow nurses to work effectively in cross-cultural situations. So in your book, there are actually 12 standards to guide cultural competence for the individual, family, community, or population. Some of these standards will appear in other parts of the course. Their first standard is social justice, and we'll be talking about that week 3. There's also critical reflection, which you will be doing this week, knowledge of cultures, which you'll be completing with your wiki assignment, culturally competent practice, cultural competence in healthcare systems and organizations, client advocacy and empowerment, which you'll be talking about in week 5, the need for multicultural workforces, education and training in culturally competent care. Most institutions have a learning module that nurses and other healthcare professionals need to complete. The 11th standard is policy development, and then the 12th is evidence-based practice and research, of course, to inform your decisions with regards to best practices. An important concept to remember is that cultural competent care helps improve health outcomes and to reduce healthcare costs, which is why there's a lot of buy-in and support for culturally competent care throughout health systems. There's an excellent article that is linked in the course room called Delivering Patient-Centered Care in the Midst of a Cultural Conflict. So it discusses the role of cultural competence and a nurse who is challenged to provide culturally competent care when that care conflicted with her own values, beliefs, and behaviors. So consider this question: how does a nurse deliver patient-centered care when the patient's health beliefs, practices, and values are in direct conflict with medical and nursing guidelines? Next week, we are going to be talking about the concept of discrimination, but we're also going to start discussing what it means to be vulnerable and marginalized, and which groups are predisposed to being vulnerable and marginalized, as well as what are the consequences to vulnerability and marginalization. You will also be asked to describe how cultural biases, fears, and stereotypes affect perception and interaction with others. Now it's time to share your own cultural stories.